Hello, Miss. To My name is Poven Rao, son of Jagannathan. My student ID number is BHCM 2450025, and my batch is 3B1. Today I will be presenting my presentation slide topic, understanding the essential healthcare management principles. My topic covering five topics, which is planning, organizing, leading, and motivation. Number two is for five key elements from hospital and ward and quality management, and principles of budgeting, and staff development program, and guide and management for intensive care unit. The um, the introduction. Understanding the essential healthcare management principle is very crucial for uh, ensuring efficient operation and delivering quality care for the patients. These principles are uh, planning, organizing, leading, motivation, and principle of budgeting, resource allocation, staff development program form the foundation for delivering uh, medical care for the patients in the healthcare setting. And following these principles, healthcare management can ensure that healthcare management can optimize workflow, ensure highly skilled medical personnel, and deliver quality care for the patients. Now I will be explaining the four steps for effective ward management. The first one is planning. Planning is the foundation for effective ward management. Planning is about setting objective, forecasting resource needs, and preparing for both emergency and routine services in a hospital ward. This way, we can allocate resources efficiently and minimize disruption in patient care. A physical example, like as an example, yeah, healthcare ward management is anticipating high admission during flu season. So he with planning he staff planning staff plan with more nurse schedule and order extra medical supplies. Isolation area for infection control and high standards of care for during peak periods of patient admissions. The second step for efficient ward management is organizing. As a ward manager, organizing is structuring both human and medical resources to achieve the set goals. Uh, by starting with defining roles for each staff and coordinating staff, establishing workflow, and reduce delays and errors. As an example, if ward management aims to improve discharge efficiency, then he can start by implementing a discharge planning team involving doctors, nurses, and social workers. This will eventually result in delay in discharge delay reduced, and more bed turnover and better care for the rest of the patient and new patients. The third step for efficient ward management is leading. As a ward manager, it's my responsibility to guide and influence my staff towards the ward shared ward's goal. Leading involves clear communication, being a role model, and effective decision making in the moment. A good leader can a good leader as a ward manager can foster trust in medical staff and encouraging collaboration and ensure staffs are aligned with ward's vision. As an example, if a medical ward is introduced to electronic healthcare record system, and the staffs are very unsure and not confident enough to learn, as a ward manager, the ward manager must learn the electronic healthcare record system first, and then lead by example by teaching the medical staff about the electronic healthcare system, health record system. This way, staff can be confident about learning it and reduce resistance to change and leads to smooth adoption process. The fourth and the final steps for effective ward management is motivation. Motivation are important for the staff to not have burnouts and maintain staff morale and produce consistent high performance. This can be done to motivate the staff. This can be done by recognition for their work and words of appreciation, and even giving them an opportunity for career advancements. As an example, to motivate the nursing teams, as a ward management, I introduce monthly staff appreciation day for appreciating their works and to helping towards the goal that we want to achieve in the ward. We can also encourage them to attend training for further develop their skills and promise a career advancement within the organization. This will improve job satisfaction within the staffs and reduce turnover and resulting in more improved and quality care for the patients. Moving on to the second topic, uh, quality management model. There are 12 elements in quality management models. The number one is leadership and management. Number two is staffing level and competency development. And number three is patient safety. Number four is clinical effectiveness. Number five is patient experience and satisfaction. Number six is communication and information workflow. Number seven is teamwork and collaboration. Number eight is resource management. Nine is monitoring and evaluation. Training and professional is number 10. Number 11 is risk management. Number 12 is continuous quality improvement. And from these 12 elements, I will be explaining five of them briefly. The first element in quality management model is leadership and management. A strong leadership and management in a healthcare setting can ensure clear decision making, accountability, and foster quality focused culture. As an example for leadership and management, a nurse manager implements daily briefings to set expectation, discuss goals, and address issues within the staff, like anything with the staff issues. This can result in improved staff coordination and timely respond to patient needs. The second element in quality management model is patient safety. Patient safety is about minimizing risk for the patient and preventing any kind of harm that can be done to the patient. There are protocols and policy that medical staff have to follow to prevent any harm to patients, and ensuring medical staff following these protocols and policies, we can give uh, safe and quality healthcare for the patient. As an example, like we can implement double check medication system in the healthcare setting or in pharmacy. If a patient wants to if a patient medication is involve a high risk drug, double check method is having two pharmacists or nurse check the medication properly if it's the right kind of medication, because it's a high risk drug. If given wrong medication, it could harm the patient. In having two medical staff check back to back, this way we can reduce medication errors and ensure patient safety in healthcare. The third element of quality management model is staffing level and competency. Staffing level and competency is about having adequate nurse to patient ratio in every ward in the hospital. Uh, every ward in the hospital, the nurse patient ratio is like decided by the demand of the hospital ward, like how much nurse patient ratio is recommended for that ward. And also making sure that the patient and nurse that works in each ward possesses skill to provide quality patient care. Like for example, match nurse skill level with patient equity. This way, optimizing assignments and reducing burnouts and medical errors. The fourth element in quality management model is communication and information flow. In communication and information flow is about effective communication and exchange of information between the staff, patients, and various medical departments. A way to ensure communication and information flow is to implement a communication tool called SBAR. SBAR. SBAR stands for Situation Background Assessment and Recommendation. This tool is commonly used in healthcare for healthcare by medical staff to exchange information about the patient's medication and treatment, so they can reduce medical error and prevent misunderstanding between the medical staffs. The fifth element in quality management model is continuous quality improvement. Continuous quality improvement can be done by data collections, monthly audits, feedback from patients, and even staff development programs. As an example, monthly audit reveals that in a ward, there's a patient falling incidents, having a problem of patients falling down. This will lead to introduction of non-slip footwear for the patients and bed alarm system for the patient in case the patient suddenly fall, so that the nurse and medical staff can know about it. And implementing this kind of actions can result in 30% reduction in fall accident within the wards. The next topic is budgeting key principle in a hospital ward. There are four of them, and the first is accuracy and realism. Accuracy and realism is about having accurate data and deciding realistic expenses and income, projection of income and expenses. using historical data and following the current trends in healthcare and future forecasts. As an example, like using the data, we can accurately forecast patient volumes and the need for medical staff in every ward, and the proper amount of medication and supplies in every ward as well. This way, accurately predicting can avoid over budgeting and can be cost saving as well. The second key budgeting principle is transparency and accountability. Transparency and accountability is about clear documentation and transparent budgeting process. This can foster accountability when making a financial decision in the world. When managers are held accountable for financial outcomes, it motivates them to promotes the responsible spending and reduce wastage. Like they're more careful with their budget and think twice about before buying anything using the budget. The third budgeting principle is organizational goals alignment. This means the ward must be aligned with the goals of the organization, like what's their aim and their plan. This type of budget and process should reflect the type of budget and process should reflect the priority of the ward and the goals of the organization. If a ward is aims to reduce patient readmissions, then the ward's budget should prioritize training staff for post-discharge follow-up programs so they can achieve their goals of reducing patient readmissions. The fourth key budgeting principle is participation and collaboration. Participation and collaboration means having when budgeting, having various input from stakeholders, doctors, nurses, medical staff, and administrators. Like for an example, when discussing about the budget and the budget process flow, and having various inputs from doctors, medical staff can ensure that clinical needs are adequately addressed, and it also promotes practical and efficient resource use. There are five benefits for following the previous four budgeting key principles. The first one is better resource allocation. Accurate and collaborative budgeting ensures that funds are directed to priority areas such as critical care equipment or essential staffing. The second one is cost control. Transparency and accountability help identify inefficiencies and avoid unnecessary expenses. The third one is improve service delivery. Aligning budgets with care goals ensures that financial planning supports quality of patient care. Preparedness for emergencies. Having a flexible budget in a ward or in a hospital can allow medical staff respond quickly to unexpected events without jeopardizing their routine. The staff engagement is the last one. Having a participative budgeting fosters a sense of responsibility within the medical staff, resulting to more responsible spending of budget and innovation in resource management and more mindful spending. Moving on to the fourth topic of the presentation slide, which is Staff development program. Staff development program is about developing medical staff to ensure quality patient care. There are 2 points. The first one is clinical skills training program. Clinical skills training program means technical and clinical competencies of healthcare staff. Highly skilled nurses, doctors, and medical personnel are needed to are very crucial to delivering quality patient care to the patients. The better they are with the healthcare skill, the better patient outcome is produced. The clinical skill training program can involve infection control practices, emergency care techniques, and knowing how to use medical technologies like the machines and medical technologies. This will enhance accuracy in diagnosis and treatments, and reduce medical errors and improve patient safety. As an example, we can implement simulation based training program such as practicing advanced cardiac life support ACLS. As a result of having medical sub training this, we can have more coordinated response during cardiac emergencies. The second staff development program is communication and interpersonal skill workshop. This involves training in soft skills like effective communication, like active listening, empathy, conflict resolution, and teamwork. These soft skills are crucial for fostering a patient-centered care environment. Having this skill can improve patient healthcare satisfaction and reduce misunderstanding between staff and patient. If a patient's family suddenly create conflict with the medical staff, having medical staff that's trained in this soft skill can diffuse the conflict and promote more clear communication with the patient's family. As an example, like organizers workshop on cultural competencies and patient communication. Gaining these skills to not just handle one type of patient but very diverse patients like multiple race people patients. This having medical staff trained in different diverse had to handle different diverse patient will also increase patients trust in healthcare services. The fifth topic is the principles for management of intensive care unit. The first one is efficient workflow and accessibility. The principle is basically the ICU and the intensive care unit layout should support smooth workflow and rapid access to patient equipments and emergency intervention for the patients. A way to apply this to is having the central nursing station, uh, uh, have it in a way that it's visible, uh, have a clear visibility of all patient bed uh, from the central nursing stations, and from the nursing station have easily accessible supply rooms, isolation units, and reduce response times in case of emergencies. The impact of this application is improving care efficiency for patients and enhances response times during critical events. The second principle of management of intensive care unit is infection control, and isolation protocols. The principle is because of the vulnerability of intensive care unit patients, preventing hospital acquired infection is very, very important. The application for this is having proper ventilation system, use of HEPA filters, uh, having medical staff trained in hand hygiene techniques, and separate isolation room with negative pressure, and clearly marked zone to minimize cross contamination. The impact of this application is reducing the spread of infection and protect both patient and healthcare workers as well. The third principle for management of intensive care unit is advanced technology integration. The principle is the patients admitted in the intensive care units are very critically ill patients. So having cutting edge medical technologies are very important to monitor and support critically ill patients. The way to apply is having advanced monitoring system, health electronic health record system, bedside diagnostics tools, life support system, and like ventilators and dialysis machines. The impact of this application is enabling real-time data access, enhances clinical decision making, and improves patient quality care and safety and outcomes. The fourth principles for management of intensive care unit is skilled multidisciplinary teamwork. Skilled multidisciplinary teamwork is basically meaning having highly skilled, trained medical staff in a medical staff team in the intensive care unit to provide comprehensive care. A way to apply this is having specialized nurses, respiratory therapists, pharmacists, and other allied health professionals who work collaboratively with clear roles and communication protocols. Having very highly skilled medical staff work in intensive care units helps the patient promote coordinated care, reduce medical error, and support holistic treatment plans for critically ill patients. As a conclusion, having a clear understanding of essential healthcare management principle is vital for successful operation of a hospital and healthcare center wards. It is very crystal clear that planning, organizing, leading, motivation, budgeting, principle of budgeting, resource allocation, staff development uh, uh, plays a major role in the streamlining operation and enhancing quality patient care. By fostering a well managed environment, healthcare facilities can ensure the development of highly skilled medical personnel, optimal use of resources, and overall cost effective service healthcare service delivery for all patients. And that is all for my presentation, miss. Thank you so much for your time and attention.